Now we'll move ahead with one of the university question which asks that what exactly superantigen is. So enterotoxin, that is scalded skin syndrome toxin, and TSST, or these two are considered as superantigens of staph. So this is class 2 MHC, that is antigen presenting cell. And suppose this is some kind of antigen, some kind of foreign particle. What happens is MHC presents it, splice it in such a way that it fits into the groove of alpha and beta chains of T4 lymphocyte. Okay. And then this is T cell receptor that also understand where exactly the epitope is present. And there would be minimal number, say 0.001% of total lymphocytes available for such kind of epitope in general. Okay. So for example, if I'm speaking about pneumococcus, capsular antigen of pneumococcus, only tiny amount of my T lymphocytes or antibody synthesizing cells would be aware about such antigen. So when such antigen is presented via MHC cell to the T cell, only minimum number of T lymphocytes will get stimulated. They will cause secretion of cytokines and then the antigen is taken care of. But in case of superantigens, what happens is this attachment is not in the groove where it is supposed to be. Okay. In the second diagram, you can see this antigen goes and sits at the variable beta region, which is outside the groove, which is meant for antigen combination. And this joining does not need the specificity of epitope. All right. So where is it goes and attaches to T4 lymphocyte, this site can be present in almost say 1/5 of the T lymphocyte. And since it goes and attaches to some different site, at one point, it is able to stimulate almost 20% of the population of T lymphocyte. And that is something which proves fatal. So because of large number of T cells which are stimulated, this leads to excessive and dysregulated immune response. Lots of cytokines are poured in, then interleukins come into picture, then there is TNF alpha, interferons. All these things are poured in the bloodstream and they have big effect. So that's how the patient suffers from, hypotension. There is erythema of the skin scalding takes place. Patient has fever, some weird sort of pain, muscle pain and joint pain and all those things. Our lymph node undergo enlargement. And ultimately patient dies of shock. So this is the reason why staphylococcal antigen is so severe in its form, and it's called as superantigen.